we start from here. Okay? So things that I like to do in these cases, I'm going to modify this because I don't want that. But I like to put and to use, in cases of deep bite, I like to do IPR in the lower arch, and normally it's a symmetric IPR that I'm going to do from distal 3 to distal 3. The idea of this IPR, you can decide if you want zero point 0.5, that I decide in this case, but maybe you need 0.3, 0.2, but the idea is always trying to do some IPR in the lower, because I want just to control the lower incisors propination, and also I need some space to do the intrusion movement. Okay, so in this case, if we compare with the superimposition, you're going to see, okay, from the beginning to the end, okay, from the beginning to the end, that this IPR is going to be solved and is going to be used by me to retrude the lower incisors, because I need some overjet in order to retrude also the upper, because if you see here, at the beginning we need a gap, and the idea here is going to be that I'm going to intrude the upper incisors, but also I'm going to retrude to close the gap. So I need to create this space. That's why I did the IPR. Okay. About the attachments that we are going to use, well, you can see here different attachments. Something that is important when you do the intrusion movement is you have to see this power ridge. You know that the power ridge is not an attachment. The power ridge is a pressure point that has the aligner, and is an indication that you are giving to the tooth enough lingual root torque when you are doing the movement. For me, it's really important to do lingual root torque when I do intrusion, because what I want to do is to move the root inside the bone. Okay, I want to move the root from the cortical bone to the alveolar bone. So to do that, you need a pressure point where the aligner is going to make some pressure in order to try to move the root inside the bone. And to do that, you will see this power ridge. How can you activate the power ridge? Okay, you cannot tell them to put the power ridge, because the power ridge is something that put the system, okay, by default when they detect an increase of more than 5 degrees of increase in torque. So in these cases, what you have to do is to ask for intrusion and increase the lingual root torque at the same time, at least 5 degrees. So you do that, you will see this power ridge in the upper and in the lower teeth. Okay, perfect. So let's see the attachments, and we have different attachments here. Look at here. The idea to intrude this case, for example, we can review the lower from here. Look at the speed curve. What I want is to reduce the speed curve doing both anterior intrusion of incisors and posterior extrusion. Okay, anterior intrusion and posterior extrusion. So this attachment that you see here in the 44 and also in the 34 are the optimized attachments for extrusion in premolars, also in the 35. These are the optimized attachments for extrusion in premolars when you want to do both anterior intrusion and posterior extrusion. So if you ask the technician to solve the deep bite doing both anterior intrusion and posterior extrusion, they will put these optimized attachments in premolars. These optimized attachments here in premolar. Okay? You have a different one in this one in the 45 because it's a little bit rotated, and they, instead of putting this optimized, they have put the horizontal gingival bevel. Okay, but the attachments that are going to work really well in our patients to apply the protocol of anterior intrusion and posterior extrusion are these ones here. As you can see here, we don't have any attachments in incisors, because remember, to intrude, we don't need any attachments in the tooth that we are going to intrude. the attachments that we need are in the teeth that we are going to use for anchorage. So the teeth that we are going to use for anchorage in this case are the premolars. So we are going to put attachments in premolars, not in incisors, okay? What happens in the lower arch? Sorry, in the upper arch, exactly the same. You can see here that in incisors that are the teeth that we are going to intrude from here to here. Look at the amount of intrusion. Also, we are going to intrude and retrude. I'm going to tell them to do intrusion and retrusion and lingual root torque at the same time. That's why you can see the retrusion that we have done. And that's why you can see the power reach. Okay? So, in the teeth that we're going to intrude, that are the incisors, we don't need an attachment. Okay? But where do we need attachments? In the teeth that we are going to use for anchorage. In the 15 and also in 25 are the optimized attachments for extrusion in premolars. Okay? Because we are going to do both anterior intrusion, posterior extrusion at the same time, also in the upper arch. Why in the 14 and the 24, 14 and 24, I don't have this optimized attachment? Because as you can see, I have put this cut here because in this case, I'm going to use maybe class 2 elastic. So there is an incompatibility between the optimized attachment and the cut. That's why in this case, instead of having this optimized attachment for extrusion, I have the horizontal gingival bevel. But imagine that you don't need to use this cut, or you prefer to delay the cut for a second phase. You will see here also the optimized attachment in the first premolars that they will work maybe a little better, okay? The idea, in teeth where we are not going to use in teeth where we are going to intrude, we don't need the attachment. So in the incisors, we don't need the attachments, and the attachments are in the teeth where we're going to use for anchorage. Okay, so intrusion in incisors, anchorage in the posterior teeth. Okay. Also, you can see here that the case is prepared for class 2 elastics, and in the second lower molar in both sides, I put a vertical attachment with the cut where I'm going to bond the button, because I like to put where I'm going to bond a button or a tube. I love to put an attachment just for anchorage in order to give a good fitting of the liner with the teeth. Okay, the attachments that are in molars are also for anchorage, because you can see here the beginning. Okay, and I'm going to expand a lot and then rotate molars. To derotate the molars, you don't need an attachment because the shape of the molar is enough to help me with the derotation. So if you plan an expansion and the rotation at the same time, just with the shape of the tooth is enough. But look at this case. I'm going to change a lot the shape of the arch. So in that cases, I prefer to put this horizontal attachment just for anchorage. And if I use it, I know that I'm going to reduce the risk of inclination of the crown when we expand a lot. Okay, so think about this attachment that we have in this first upper molar just for anchorage, and if you have a good size of the crown, you don't need to use it. But if you feel more secure using that, it's good, and it's a good option because it will increase the fitting of the aligner with the crown. I hope this part of the liner is going to be clear, and now you can copy these attachments that I have used in this case and apply that to your cases in order to start having better results.